Clinical Service Inclusion Lead. My remit is health inequality, and my role is to support our clinical service. We have 3 inclusion coordinators that are actually with our team right now, one in the perinatal service, the crisis service, a community service, and we're just about to interview someone for our eating disorder service as well.
I'm a clinical engagement, access and inclusion coordinator. I work within the Perinatal Mental Health Service.
My role centres very much around the transformation project, which is all around transforming mental health services in Leeds.
I'm a clinical inclusion coordinator for the crisis service. I'm also a nurse by background, and also aside from that, I'm a cultural inclusion ambassador.
So as a service, the inclusion team have clinical inclusion coordinators that are actually embedded within the clinical areas to support the service lines to look at the way in which we are delivering, and we are thinking about the way in which people are using our services from a barriers perspective and a preventatives perspective.
A key part of my role is engaging with the community just around their experience of accessing services. One of the key issues is around the barriers.
So when it comes to people from diverse communities, there are higher disparities impacting on their maternal mental health and well-being. The communities that I'm reaching out to involves the Sikh community and the Muslim community. I've been connecting with places of worship and our faith leaders.
As part of the clinical inclusion team, I essentially support the crisis service in meeting the health inequality goals. So at the moment, in inpatient services, there's quite a disproportionate level of those from ethnic minorities admitted under the Mental Health Act. So my role is supporting our service in reducing these admissions and in reducing these disparities.
For us to think about health inequalities in its entirety, we need to think about the different factors and elements that may impact people accessing our services, and that might be their ethnicity, their sex, their disabilities, other elements that may contribute to different health outcomes. To consider where they live. So someone living in an inner city versus a rural area might have a different experience in terms of fresh air, green spaces. We also need to think about individuals who might be homeless and how they access service and what sort of disparities that they experience. So all of these individuals and all of these elements are important to think about and consider when we're actually offering services to individuals.
We have team meetings where we're able to have a safe, open platform to start talking about diversity and inclusion and how we can really embed this within our service, and look at how we can get our service users involved as well, because a lot of the work that I do, it involves giving our service users a voice.
I've been a young carer for a loved one for quite some time who was also from an ethnic minority community who suffered with mental health problems and definitely did experience disparities in their care. So I feel this role is really, really important. You know, I feel like it's come at a good time, and I really hope that we can make some improvements in care. It's a very important topic.
I mean, a lot of the time we hear stuff around hard to reach communities, but I would say, you know, maybe easy to ignore. So I'm real passionate around getting the information.
We can then take back the information that we gather, what our service users are saying. We can then learn from that and to help really improve the delivery of our service, the care that we're providing.
We are considering what people's individual and personalised needs are and ensuring that we place our service users at the heart of what we do. So we are co-designing and co-producing new ways of working, delivering training to our staff group to ensure that they have the right competency and the capabilities to ask the right questions, to frame it correctly, and to learn and grow from each other.